Greetings, Eric Bakker, naturopath. Thanks for coming back and checking out my videos. I have a question here today from somebody over in America. And the question is, why is there mucus in my stool? So this person wants to know why they have high levels of mucus when they go to the bathroom. There can be a whole bunch of different reasons for this. So we're going to talk about a few different scenarios today and explain a bit about that. So mucus is normal in the stool because it's secreted by, the mucous membranes in the digestive system. So very small amounts of mucus are quite normal and found on stools, but when there's excess levels or you find lots of slime on there, or like you can really see a huge amount of mucus, especially if it's accompanied with pain, cramping pain or bloating or gas or things like that, it may need further investigation. So this is, if you're concerned and you notice this time and time again, this extra mucus, also check for blood in particular and things like cramping and gas and bloating. Definitely go and get checked out by your doctor. Get blood tests done. You may need further exams done. It could be, CT scan, or it could be colonoscopy or an endoscopy, or further, specialized testing to determine what is going on. But it could be an infection. It could be a bowel obstruction. It could be proctitis, which is inflammation of the lower part of the gut. Infections can often cause this temporarily, like mucus. I've seen this with different parasites with people. I don't often see it with Candida. I tend to see it more with bacterial and especially parasitic infections. I've seen lots of cramping, bloating, and lots of mucousy stools occur. Some people, in particular with inflammatory bowel disease, have a lot of problems with mucus. So Crohn's disease, for example, is quite a common one to have excess mucus production. And we see it also with inflammatory bowel disease, by the way. It's in both conditions. So a stool test will pick this up. Many times we see this in conjunction with high inflammation. So if your inflammatory marker is elevated, mucus will be there and the pain will be there. The cramping pain, and then the excess stools will be there. It's often a combination. Sometimes it could be polyps, a series of polyps that are irritating, the gut, that need to be discovered basically through a colonoscopy. And again, with polyps, there could be a further potential for other inflammatory markers to be elevated, like calprotectin, for example, or lysozyme could be elevated. So again, as I mentioned, other tests will need to be done to determine what is going on there with mucus. So if in doubt and you're concerned about it, my recommendations are absolutely to not to hesitate, but to go and get checked out. It doesn't necessarily mean you've got cancer, but it certainly means if it's recurrent or long term, that there's some level of inflammation or irritation of the mucous membrane going on, and its cause needs to be detected before it does create an illness in you. So I hope that gives you a little bit of an understanding on mucus there in the gut, to get it checked out. And normally it's quite okay, it'll pass, but if not, go further. You don't want to be anxious about it. Thanks for asking the question.